So hello friends, today we will be studying about dose response curve. So what is this dose response curve? It is a graph between plasma concentration of a drug on the x-axis versus the effect or the response produced by the drug on the y-axis. Okay, so this dose response curve is given by a DRC. It can be of two types. It can be either quantal or it can be graded. Now when we need the quantal dose response curve, if there is variation in the sensitivity of the response to increasing doses of the drug in different individuals, so that can be obtained from the quantal dose response curve. Quantal TRC, there is variation in sensitivity of the response to increasing doses of the drug in different individuals. Now when the response is all or none, in such cases quantal dose response curve is done. So the y-axis, it shows that number of persons who are responding, and the x-axis shows the plasma concentration of the drug. Okay, so from here we can get the median effective dose, or it is otherwise known as ED50. So what is the median effective dose? It is the dose that produces the desired response in half of the recipients, that is 50% of the recipients. Okay, so that is the median effective dose, or ED50. So more is the ED50, the lower is the potency of the drug. Next is median lethal dose, that is LD50. So what is this LD50? It is the dose that will result in death of 50% of the experimental animals receiving the drug. Okay, so more is the LD50, the safer is the drug. Now the ratio of this LD50 to ED50 is a measure of safety of the drug. Is the ratio of LD50 to ED50, and this ratio is called as therapeutic index. So therapeutic index is equal to LD50 by ED50. You can remember this by the mnemonic TILE. Okay, so therapeutic index is equal to LD50 by ED50. So suppose this is a quantal dose response curve. Okay, and in this we are seeing the therapeutic response, and in the red I am marking the lethal response. In the y-axis, as we have already discussed, what will give? We will give the percentage of population responding, and in the x-axis we will give the log of dose, which reflects the plasma concentration. So this is when 50% of the population is responding, it is ED50, and when the 50% of the population dies, that is LD50. So the ratio of LD50 to ED50 is the therapeutic index, and that is the measure of safety of the drug. So the drug which are having higher therapeutic index are safer, whereas the drugs which are having lower therapeutic index, they are likely to be toxic. Okay, so this is all about the quantal dose response curve. Now coming to the another type of dose response curve, that is graded dose response curve. What is this graded dose response curve? This shows that the response is graded. Like for example, the reduction in the blood pressure of an individual. The y-axis shows the magnitude of response, whereas the x-axis it shows the concentration of the drug or the dose of the drug. Y-axis it shows the magnitude of response, whereas the x-axis it shows the concentration of drug or the dose of the drug. Okay, so generally the intensity of the response it increases with the increase in dose of the drug. So it is usually a hyperbola. When you plot the dose of the drug in x-axis and the response, the magnitude of the response in y-axis, it is generally a hyperbola. So shape of the dose response curve is a hyperbola. But this hyperbola, the curved lines of the hyperbola cannot give good mathematical comparisons. So usually the dose response curve, this dose response curve is converted into something which is called as log dose response curve. So in this what happens, the dose response curve, as we have studied it, the shape is a hyperbola. So mathematical calculations cannot be done. So it is converted into a log dose response curve, and this log dose response curve is a sigmoid shaped curve. Okay. So what is the shape of dose response curve? It is hyperbola. Log dose response curve it is sigmoid. Now what are the parameters which can be determined from the dose response curve? There are three important parameters which can be determined from the dose response curve, that is the potency, second is the efficacy, and third one is the slope of the dose response curve. Now coming to potency. So what is this potency? It is a measure of the amount of the drug needed to produce the response. Measure of amount of the drug needed to produce response. So the drugs which produce the same response at lower doses, these are more potent. Drugs producing same response at lower doses, these are more potent. Okay, so suppose for example this is a log dose response curve and there are two drugs which are acting, drug A and drug B. So in this particular graph, which is more potent, drug A or drug B? The answer is drug A is more potent than drug B. So in DRC, more a drug is on the left side of the graph, the higher is its potency, and a drug on the right side of the graph, the lower is its potency. You need to remember this dictum, that if a drug is more on the left side, it has higher potency, whereas if the graph starts more from the right side, then it has lower potency. Coming to the second parameter, that is efficacy of the drug. So efficacy is the maximum effect produced by the drug. Okay. Now where it will show the maximum effect, it can be shown in the y-axis. So the greater the peak of the curve, the greater is the efficacy. For example, in this graph, if these are two drugs, drug A and B, B will be more efficacious than A. Why is this? This is because the peak of B on the y-axis, it is more, and y-axis shows the effect or response of the drug. So the drug which has got more effect or maximal effect of the drug, that is the efficacy. So B is got more effect than A. So this, from this graph we can write that A is more potent than B, but B is more efficacious than A. Now which of this is more important clinically? Efficacy is clinically more important than potency. Efficacy is clinically more important than potency of a drug, and therefore efficacy is a more decisive factor in the choice of the drug. So in one simple line we can remember that the position of the DRC on the dose axis is the index of drug potency, which refers to the amount of the drug needed to produce a certain response, and the upper limit of the DRC, that is the y-axis, is the index of drug efficacy and refers to the maximal response that can be elicited by the drug. So this needs to be remembered, that position of DRC on the x-axis, that is the dose axis, is index of drug potency. Okay, and what it signifies? It signifies the amount of drug needed to produce a certain response, and the upper limit of DRC that is the y-axis is the index of efficacy of the drug, and this refers to the maximal response that can be elicited by the drug. Okay, now coming to the slope of the DRC. So a steep slope of a DRC indicates that with a little increase in the dose, there is markedly increased in the response. Okay, and a flat slope, it implies that the little increase in the response will occur over a wide range of dose. Steep slope, little increase in dose will cause a marked increase in response. So the dose has to be individualized. flat slope, little increase in response occurs over a wide range of dose. For example, in this, if we plot fall in BP versus the log dose of two antihypertensive, namely hydralazine and hydrochlorothiazide. Okay, so this is the slope of hydralazine and hydrochlorothiazide. So this has got a flat slope. So here little increase in the response is there with wide range of dose. Okay, and in this there is a marked increase in the response with a little increase in the dose. So the dose of this has to be individualized for different person. And the DRC, which is steeper, have narrow therapeutic index. Now DRC can also be utilized to know whether a drug is competitive inhibitor or non-competitive inhibitor. In case of competitive inhibitor, the curve will shift to right. I am marking this as 1. Okay, so suppose we plot log dose and response curve. So this is, suppose for example, A is the drug, we give another drug which is competitive inhibitor of this drug A. So the curve of this will shift to the right. Okay. Now in case of non-competitive inhibitor, there will be flattening of the DRC. That is, the efficacy decreases. Okay, so in this graph, B is a competitive antagonist of drug A. So that causes the parallel shift of the drug of the DRC to the right, which means that the potency will decrease. Whereas C is the non-competitive inhibitor, which causes flattening of the DRC. Okay. A is when it is drug is given alone. B, drug plus competitive antagonist, and C is drug with non-competitive antagonist. So you just need to remember that in competitive inhibition, the curve will shift to the right, and in non-competitive inhibition, there will be flattening of the dose response curve, that is, the efficacy will decrease. So this is all about the dose response curve. So quickly revising, the dose response curve, it is a graph between the plasma concentration of the drug on the x-axis and the response produced by the drug on the y-axis. Okay, so the drug response curve can be of two types. One is quantile and graded. So quantile, how it is assessed, in which drugs? The drugs showing all or none phenomenon, and there is variation in sensitivity of the response to the increasing doses of the drug in different individuals. Okay, so the x-axis, it shows the plasma concentration, and y-axis shows the number of persons responding. Now here two things can be seen, ED50 and LD50. What is this ED50? That is the median effective dose 50. It is the dose that produces the desired response in half of the recipients. And lethal dose 50 or the median lethal dose, it dose that will result in death of 50% of the experimental animals. Okay, so more is the LD50, the safer is the drug. And the measure of safety of the drug is given by the ratio of LD50 to ED50, and that is therapeutic index. Now coming to the graded dose response curve, in a particular individual, by increasing the dose of the drug, the magnitude of the response is assessed. So the dose response curve is a hyperbola normally. So in this dose response curve, it cannot give a good mathematical comparison. So the dose response curve is converted into the log dose response curve, which has a shape of sigmoid shape. Okay, so what are the important parameters which can be assessed from the dose response curve? They are the potency, efficacy, and the slope of the curve. So potency is a measure of amount of the drug needed to produce response, and the drug producing same response at a lower dose is more potent. Okay, then what is efficacy? It is the maximum effect produced by the drug, that is the y-axis indicates this, and efficacy is clinically more important than the potency of a drug. So efficacy is a more decisive factor in the choice of the drug. The position of the DRC on the x-axis, that is the dose axis, is the index of the potency, whereas the upper limit of the DRC, that is the y-axis, is the index of efficacy. Now coming to the slope of the DRC. A steeper slope will indicate that there is a little increase in the dose will cause a marked increase in the response, and a flat slope will indicate that there is a little increase in the response over a wide range of dose. So the DRC which are having steeper slope, they have a narrow therapeutic index. Now from the DRC also we can know whether there is competitive inhibition or non-competitive inhibition. In case a competitive inhibitor or competitive antagonist is given along with the drug, there will be shifting of the dose response curve to the right side. If a non-competitive antagonist is given along with a drug, then there will be flattening of the dose response curve, that is the efficacy will decrease. Okay, so this was all about dose response curve.